a son of Montreal.
I'm the son of Montreal. Yeah.
Okay, where are we holding with Leonard Cohen these days?
Leonard Cohen. How is he? How am I being processed through him?
Yeah.
Individual.
If you've been, smelling the same air and drinking the same water and the same bagels, maybe there's.
Yeah, yeah. We have. I guess I have some element that there's some of his residue in me in some way. I didn't follow him too much, but my biggest memory, he passed away about a day after Trump got elected, and we were
That's
we went to Great Barrington. We went on this trip with another family, and they were this person we went through, Liel Leibowitz, who's you might know him. He's a
of
big
course
writer.
from tablet. Yeah.
His family, and he was so distraught by the election, and then he was very fond of him, and those two events together were just a lot for him, and it was a very difficult weekend. But we pushed through, and we ended up having fun. So.
What was your Jewish upbringing like? What side of Montreal were you raised
So
in?
yeah, the very, sort of a very shtetl-like environment. We grew up, because Montreal was mostly French. The Jewish community lives very, very isolated in its own container almost, as do all the other groups. The Greek people live together, the Italians, the Lebanese, everyone has their own group. So I lived in a very, very, a very Jewish world. I mean, I thought the whole world was Jewish other than Donnie and Marie. And they have their Christmas specials. I thought the whole world was Jewish until I was much older, believe it or not. So I went to Jewish school and lived my grandparents were all born in Europe and grew up in shtetls in Belarus. So we're Yiddish speaking, very warm Yiddish speaking, that type of world. And so that was a very big part of my upbringing. So.
Was a path of medicine something that was required, inspired, hinted at, or your own inspiration?
Totally my own inspiration. There are no doctors. My parents were trying, they were just trying to survive at that point. They're immigrants making enough money to get by. And so, yeah, my parents didn't even go to college. So it was never a requirement for me. It was my own my own passion. I felt like I was sort of just brought there. and, and I found myself in it rather than it was something that I actively made it. I mean, I had to make a large effort to do that, but it was brought to me.
And was mental health care like your first stop, or did you arrive at it at some later point in your
Yeah, I mean,
training?
when I went into medicine, I actually wanted to be a pediatrician, and then a bunch of very long, difficult nights with sick children sort of put me off to that, and I went into internal medicine. But it wasn't one of my passions. My psychiatry residency was very difficult. But it was only by being a primary care doctor and working through, I really worked through the AIDS crisis in the city. I became medical director of an alcohol and heroin detox center in the city in Manhattan, and then going into primary care, I dealt with a lot of mental health, tons of it, and I started to see actually the link between our consciousness, our mind, and our mental health, and our physical health, and that they're not so separate as we think. And so I got very much involved and started to really incorporate that into my primary care practice very much. Yeah. So.
So that meaning just your approach, your orientation to your patients, or kind of the
Yeah.
interventions that you were suggesting alongside medicine or treatment or therapy.
Yeah. I think I have to say, really, it started. I was, oh God, it was probably about 20, 15, or maybe 20 years ago. I had a patient of mine who he wasn't Jewish. And he says, you should really read this book, The Power of Kabbalah. I'm like, a small book. And I'm like, okay. And I read the book, and I don't know, it just really, it got to me. It really changed the way I saw the world. And I started studying it more and more and getting into it, more Hasidus, and all that. So it wasn't just this very esoteric version of Kabbalah, but really the Hasidic version of it. And that changed. That was my real psychedelic experience, actually.
Hmm.
And psychedelic, and it was like putting on another pair of glasses and seeing the world in just a completely different way. So you don't have to do substances to have a psychedelic experience. And I started building on that and building, and that completely changed my life in incredible ways. So, and that allowed me also to see medicine in a much more spiritual way, to the point where, in physical exams, I would always ask people, one of my questions was, do you have a spiritual life? Is there anything, do you believe in a higher power? Do you meditate? Do you do yoga? Like, I started asking about other things involving more the spiritual aspect to help them also heal from that perspective. So, and those who were open to it, I would continue and guide, and those who are not, I would sort of redirect, and I wouldn't push it on people, but at least make people aware of it.
So it sounds like you were kind of discovering your own holistic model for your approach to patient care.
Yes.
So the Power of Kabbalah is a book by Yehuda Berg,
Yeah.
um, connected to the Kabbalah Center, and that was your first stop in Jewish mystical wisdom.
Yeah.
Had you had any encounter in your, growing up in a deeply immersive Jewish environment, Jewish school? Was there any kind of like priming you toward that receptivity? I mean, Kabbalah literally reception, receiving.
Right.
Can you maybe imagine any moments in your childhood, your adolescence, where there was a moment or several moments of expanded consciousness, or was really like the power of Kabbalah
Yeah.
the gate?
It woke me up. I always had more of an interest in the religion, but my parents were not religious. They're the sort of the post-Holocaust group. They were trying to sort of establish themselves, in a more modern world after growing up with Yiddish speaking grandparents. My father's, my father's family, my father's first language was Yiddish. That's his parents only spoke Yiddish in the home. So they were really trying to move away from that. So he grew up kosher, but then they completely moved away from that. So I really didn't have much of it in the home, but I did always have a yearning for it to some extent. And then it was only years, and then I really put it to the side for I wasn't kosher. A couple of times, I started becoming a little bit more so. I remember I was sitting in a restaurant in London, and I was working there for a summer, and it hit me. I was in a restaurant, I was eating pepperoni pizza, and I'm like, just doesn't feel right. Like there's something, like I'm a Jew, and I just shouldn't be doing this. Not that it's bad or good. It's not what I do, and I didn't feel right. So I came home. I said, "Mom, no more. There's no pork, and I don't want to eat milk and meat." That was it. I didn't push the kosher meat yet. That would be too much at that point. I since have, but and I just, yeah. So it definitely was inside of me for sure. But and then, yeah, the power of Kabbalah. It really, I think the way I learned Judaism in my Jewish school was unfortunately, it was a missed opportunity to bring people into a more spiritual version. It was not spiritual at all. And when I realized what our religion is all about, that the deep wisdom, and it's almost like a science. It's a way of living your life in such a beautiful way. It's not religion. It's essence, and that really that really transformed me. So it was really that book, and very simple book. And then I obviously did other things, and I found my way into other, but that was definitely my introduction, and a very powerful one.
And how did that? Because I know about you, we had a very long conversation. I was hiking somewhere. We were on the phone. It was during lockdown. Very
Yeah.
memorable conversation. Talking to a stranger about very deep things in a moment of planetary crisis. But I know that you've practiced TM. You've done lots of forms of yoga. And so, can you talk about that blending of the traditions? What does that weave work look like inside your body, inside your heart these days?
I mean, what's reassuring is when you go and you read all these other things, from Buddhism to Hinduism to the yoga to the TM, they all sort of say the same thing. Like there's this, it's reassuring to note that there is a universal wisdom out there. There is a structure to this universe, and and the spiritual and physical universe. So, and all those things, they almost say the same thing in different language. I like our language, and it's just the way I was born. So, really, that's why the Kabbalah. But it actually helped me get closer to my Judaism by sort of venturing into those things and realizing the power. And I think the beauty of Jewish spiritual wisdom is it takes it another level. It gives us a purpose, an overall purpose. There was something missing in some of those things. Maybe for me, because I am obviously biased. It's who I am. It's a huge part of who I am. I'm very close. I feel very strong about being Jewish. I'm very proud to be a Jew. But it was beautiful to know. So it brought me, all those things brought me closer to who I am as a Jew. Yeah. Similar to Ram Dass, he had the same similar, he went really far. At the end, it's funny. Yeah, I remember I watched that thing, and he did go and sort of reconnect to some extent. I mean, he was never very close to it growing up, but he did go back to a rabbi, I think, and he did find some connection there at the
Yeah,
end of his
absolutely. He cultivated a relationship with Reb Zalman,
right.
and through Reb Zalman, I believe he was introduced to like Rebbe Nachman's stories in English, and I've heard recordings of him talking about, if that had been available to me before this entire process, maybe things would be different, because this was the first time that I had seen something inside my tradition that spoke to my spirit like that.
Exactly.
Um, and there's a great lecture that he did at the University of Judaism. He's got like a black turtleneck and a white jacket, and he's very tense speaking to this room of Jews about Judaism and spirituality. But yeah, I mean, at some point he recognized there is that deep well, but the train for him had kind of passed.
Right.
Yeah.
Right. Yeah.
So you have this rich inner life, it sounds like.
Yeah. Yeah.
And you have done, I think, some incredible work in other spheres of medicine and patient attuned care. Tell us how you came to ketamine. Was ketamine your first stop? I can't imagine that you just landed in a world-renowned ketamine clinic. Where did that actually start?
Yeah. I mean, probably started years ago. I'm married to a man. I'm gay, and my husband at the time. After our first son, we have two children, and our first son was born. He developed really severe headaches, terrible headaches that would come on at a specific time and end at a certain time. It's very odd. Anyways, he went through multiple neurologists and medication. He had sinus surgery, acupuncture, Botox, everything, you name it, meditation, amitriptyline medications, and eventually nothing really fully got rid of them. And then we were actually we're thinking of opening up a more holistic health center. And we went to go speak to somebody about a center that they opened up. And the entire conversation was about plant medicine the whole time. So, which was interesting. And we really hadn't really given it much thought before. But it did, it was interesting. So it took us about a year to get there. And a year later, we said we might as well try it, see if it helps with the headaches. And in the first journey, we went, it was a group journey. He was shown where the trauma was coming from, and his headaches completely went away after one. He had a lot of trauma. Growing up, he grew up in a Sephardic, very sort of Orthodox community in Paris. And so religious, went to Orthodox school and all that. Not ultra religious, but just typical Sephardic. And it was not an easy place to deal with his sexuality, of course. And this really helped him, and we saw the power in it. And then we started experimenting, not excessively, but we tried a number of different treatments and different types of plants. And I saw that it's just incredibly beautiful work when done, with intentionality. It's incredibly powerful. So the COVID hit. When COVID hit, I knew that there was going to be a massive issue with mental health. And someone called me, someone I had met during one of those experiences, and a fellow Canadian, and said, I'm looking to open up a ketamine center for psychedelic medicine, and I need a doctor. And I said, okay, and I'll try it. I did it part time, and I started working in it. And after working here, it blew me away. It was much more powerful than I had anticipated, and much more effective than I had ever anticipated it would be. And soon after, about maybe a year into it, I went full time. I gave up my private practice and everything, and I haven't looked back. So,
Well, before we talk about Nushama and what the vision for this clinic is, maybe you can talk a little bit about ketamine. So, what is ketamine? Often people have said ketamine isn't a psychedelic. So, what does that mean? And maybe we can talk about where ketamine treatment and research is right now. So, maybe just starting there. And
I mean, yeah. So ketamine is a really, really interesting medication. It's been around since the 1960s. It was initially approved as an anesthetic agent, and an unusually safe anesthetic agent, because it's one of the few that has no effect on people's respiratory drive, their heart output, so how their heart beats, and their gag reflex. So and because of that, it's an incredibly safe substance. It's actually on the World Health Organization's list of essential medications or drugs that every country should have proper stores of in case of emergencies. So it's used in children, in pediatric cases, especially in emergency situations. If a kid, God forbid, breaks a bone or something, it helps really lower anxiety and pain. And it's given in much higher doses actually than what we would use, even in our centers, strangely enough. The interesting thing about ketamine is that, depending on the dose, it's almost like a different drug. There's a completely different effect depending on the dose used and the route of administration. So, in really high doses, it's used as an anesthetic agent, so it can put people out. They lose consciousness, and it's usually used in conjunction with other anesthetic agents. They usually mix different things to put people out for surgery.
what
In
would
the
what would be considered a high dose? Just to give some.
Oh, it's really relative to people, but well over, anything like, over 3 milligrams per kilogram we dose by weight. You know, again, some people at 2 milligrams they're awake and they can talk to you, and other people they're out. So it really depends. So high dose would be well over that. Well over, like I'd say, definitely over 2, 3, and low doses, which can be used, you see people doing, outside with lozenge, nasal sprays, and done in more recreational settings. It affects different receptors in lower doses, and it can be more euphoric in certain ways, or a little bit more of an escape type of experience, but not a psychedelic, you know. But when you use it in this sort of mid-dose range, so sub-anesthetic, under anesthetic, but more higher than this sort of recreational general use, it is a psychedelic, and anyone who's ever done it will attest to that. It's probably the most psychedelic substance I've ever experienced in my life. And I've tried a number of different substances in controlled settings. So yeah, so it's really about how you use it.
Hmm.
The safety again is unparalleled. I don't worry about the safety, even in very high doses. It's incredibly safe. But in our clinic, we use it in a general range of 0.8 to around 2 milligrams, but generally a little bit lower than that. So
Just want to pick up on the phrase that you just used. It's the most psychedelic.
yeah, the most. So what
The
is
most,
psychedelic?
which is funny because when there's like criticism about ketamine that you hear that it's not a psychedelic, it's a
Oh,
dissociative. And so what I'm hearing from you, very interesting and inverse and intensified understanding. So what does it mean for ketamine to be the most psychedelic subjectively? What's that subjective experience like?
I'll give you like a thing. When we use the word dissociative, it's really not. It was a term used by the drug company, who Parker Davis, who was trying to market it, and they couldn't the word, like, they couldn't use the word psychedelic in those days. Of course, that would be a very bad side effect, and no one would use it. So they came up with the term dissociative, and it's not. It's more ego dissociative. So you have sort of a dissociation from sense of self, the egoic sense of self. but it doesn't dissociate you from your emotions. There is a negative connotation to dissociation. So in severe mental health issues, when people have no access, they dissociate from their emotions. They don't have access to their emotions. They sort of shut down. That's a different type of I call that sort of a more of a soul dissociative. But what it does, it inhibits the processing centers that give you a sense of self. And when you start to take this on, it's almost like a chemical key to the ego, and it's like and it dims it gradually depending on the dose. And as you start to dim it, you take off this filter system, you get to experience reality in a much more creative and more open way that's not limited by our fixed five senses. And so like music, when you're listening to, and the music has a big influence on what you experience. So you'll almost see, it's called synesthesia, where you're going to actually see the music. And different tones and different intonations will elicit, like many other psychedelic substances, will elicit different types of visions. And with an eye mask on and earphones, noise canceling, it becomes very immersive, and you can have incredibly significant sort of dreamlike sequences that seem much more real than what we're looking at right now.
Hmm.
And but if you take off the mask and the earphones, then a lot of those visions will go away. And if you turn off the drip, it dissipates pretty quickly. So from that perspective, yeah, it's and that's how I think what people say. So it's really how you use it, and the music, and the environment and the set. And we talk about set and setting, and that's the same with any substance, whether it's any of them. The set and setting really does determine your overall experience and what you're going to receive from this work.
So you've shared about the set and the setting, the importance of music, the kind of dosage, and the subjective experience. Is there any sort of agency in a, like, let's say, like a regular dose?
Mm-hmm.
Could a person take off the mask and start talking at that moment, or is there just does that person disappear for a number of hours, minutes? What actually is happening to that person? Do people still have their agency?
Right, right. Okay. Yes, they do have their agent during the drip, and as we escalate the dose, obviously it becomes more dissociative. So you're a little bit further away from this version of ourselves. So again, if we take off the mask and the earphones and we turn off the drip, they'll come back to themselves. But during the experience, you're almost more alert. You're never sleeping. You're more alert and more conscious than you are right now. And what comes up in these journeys, also determined from the actual music, is a big part of it. Is you're sort of this beautiful, there's this consciousness watching it happen. I call it liquid meditation. So it allows us the visuals that you see come, and then the music stops and everything sort of dissolves, and you may dissolve with it. That is a backdrop to you appreciating who we are, this beautiful calm presence, just watching it come and go. And these unbelievable multidimensional experiences are just there for you to appreciate that. And I think it's like that in life. I think we're here to appreciate the godliness inside of us through some of the darkness. It's like, I give the example, like, how you can't appreciate a candle. You take a candle and you put it up to the sun. You don't appreciate it. But you take a candle and you put it into a dark room, you can start to appreciate the beauty of the flame and the blue area around the wick. You appreciate it. So I think some of what we experience in this physical world is just there as a backdrop, as a contrast to appreciate the beauty, within us. And I think that's the power of this type of medicine and this type of work. Yeah.
And with other types of psychoactive substances, can people also have difficult, painful, bad, frightening experiences with ketamine, or do you see fewer of those with this particular substance? Where does it fall?
No, I think so. It depends on what people are coming into the journey with. We do encourage people to do some work before. So, intention, we prepare people. We send them intention worksheets. They work with the integration coach before to prepare them. I talk to them. So we prepare them. But I don't believe in bad trips. It's only bad if it's not contained and not processed properly. Then a difficult journey can turn bad. It's like in life, we can either learn from our difficult experiences, or it can turn into trauma and entrenched in our psyche. But we can see, but every experience in life, there's a jewel. I believe there's some wisdom, some strength to be gained from that. And the same thing in these journeys. It's just if it's properly processed, I found that the difficult experiences during a psychedelic, journey could be the most therapeutic and most helpful. And that's what I see here. I don't believe that anyone goes anywhere they're not meant to go. And I really believe this. And I believe this gets a little spiritual. I guess this is the proper place to discuss this
Yeah,
because
let's talk
some people
about it.
realize, but I believe it's your soul, it's our essence guiding the entire thing. And you don't go anywhere you're not meant to go. And I've seen, I don't know, close to 9,000 of these come through here. And even the most difficult ones, and I've seen some difficult ones, have been the most healing. But again, it's how it's like in Kabbalah or in Jewish mysticism, like the way interpreting a dream. And every night we go to sleep, it's a psychedelic experience. It's crazy if you think about sleep. We have to let go. It's almost like we consider it almost a mini death. And within those experiences during it, you can have there's no such thing as a really bad dream. It's just can be a bad interpretation. And we're told to be very careful who we ask to interpret, who we tell our dreams to you have to be very careful with that. And the same thing, I think, with a psychedelic experience, you have to have the proper person to interpret what comes up in these other states.
Yeah, and even the ritual, even the liturgy,
Yeah.
is that a nightmare can be interpreted litova. It could be interpreted for the good as a bracha, and not necessarily as a curse or some demonic presence or vision. So it's an interesting perspective. Maybe get into the nature of challenging experiences another time. But so we've been talking about ketamine, set setting, music, but I want to talk about where it's all happening for you. I want to talk about Nushama. Where did you help found Nushama? Did you came in at the same time while it was being founded?
Yeah.
And what does Nushama mean?
So Nushama, Rich Maloff came up with the name. So it's obviously comes from the name Neshama. And they're singing 5 levels of the soul in Jewish mysticism. And the one in the middle is Neshama. It's the balance. It's between the more ethereal parts of our soul. It's like almost like a cord, umbilical cord up to the upper worlds, to God. And so God's everywhere, along every level, but then there's more manifests. There's sort of lower levels of it, and the neshama is about finding that middle ground between. So it's all about, I see it's all about balancing. So I got into, that's where the name comes from. And also new shaman, so
Hmm.
new shaman. So it's sort of a
Okay.
play on both of those words. We're 3 Jews. All of us are Canadian Jews who came up with it. So I thought it was appropriate. Started the center. And so I was in at the beginning of this and helped sort of guide it and take maybe a little bit more of a spiritual approach to this. Sort of, I see it as a midway between medicine, science and spirituality. And I don't see spirituality as non-science. I think it is a science that we're just not there. We're not that advanced as we think we are. We're not. You read Kabbalah, it's science. It just we'll one day get there.
Well,
But
something that struck me about the space itself. So you're located in Midtown New York. You are in a beautiful building. You take an
yes.
elevator all the way up, and when you exit the elevator, what I was really struck by, and the only thing that came to my mind is this is a psychedelic space. There, the detail to beauty and ease, softness, natural tones, a lot of green, a lot of brown, soft pink and orange. There are books, there's Sfarim. You have some of the greats of psychedelic literature. And what really struck me, which was a surprise, is when you're walking through the hall of the treatment rooms, that all of the rooms are named after particular people. Can you tell us about the decision, and what's the aesthetic that you're going for other than psychedelic? Like, why this kind of space?
Yeah, I mean, we try to sort of declinicalize as much as possible. I think it's important. It's a place where we're opening ourselves up, our souls up. So, and when you do that, I think having a nurturing environment is very important. People have to feel safe. When you go into a psychedelic experience, if you feel safe and held, and you have reverence to the people actually who brought this beautiful work to us, so there's a respect for that too. I think you're more likely to have a better and a more meaningful experience.
Mhm.
So we spent a lot of time and effort and money to create this, a place that really leads to that place of safety and openness. So that was a big part. Even the reading, the books, and the everything, and then the staff and the way we train our staff is very important. Everybody here, goes through the treatment. We would never give anyone a treatment that we ourselves wouldn't take or we wouldn't give to our loved ones. We have, so people hopefully when they come in here they feel like they're not walking into just another medical clinic. They're, at least not now, maybe a medical clinic, hopefully what they'll look like in maybe 100 years from now. Majority, yeah.
It's deeply beautiful and clearly reverential, especially for some of the luminaries of the psychedelic field. The the placard of the Griffiths room when I was there, especially after he had Roland Griffiths, who was the lead researcher at Johns Hopkins, had just passed away.
Right, he just
So
yeah.
so you have this beautiful space, you're doing this beautiful work, and I'm interested. I think probably most people who encounter ketamine, certainly on social media, are encountering ads, most likely on Facebook, Instagram, for at-home ketamine. So yours is decidedly not at home. You've created a home away from home, spiritual home away from home. But can you talk a little bit about the difference between what you are doing and what some of these at-home ketamine treatments are offering?
Yeah, I think what we're offering here is true psychedelic. I'm very strict psychedelic medicine, and psychedelic medicine is like I talked about when I had my psychedelic experience with spirituality, with studying Kabbalah. It's the same thing with this substance. I think it's about opening ourselves up to seeing the world in a new way. It's about expression. It's about expressing our emotion, expressing ourselves, expressing our souls, not suppressing. And any agent, there's a lot of agents out there to just suppress the emotions. And I don't think that's the point here. So I think, take home ketamine, it makes you feel good. You'll take it, you'll feel good. And people tend to take it when, feeling a little stressed or anxious but overall, I think it's more, its intent is more suppression. If most of these outfits, they tend to, it's an ongoing treatment. And I've had a number of people come into our center who have taken it and didn't really find much help with it. They found that they were given a lot of these sort of lozenges or a nasal spray, and with no direction, no integration at all. And they're doing it alone, sharing it with their friends. And I think it's quite dangerous, personally. Not only physically dangerous, as we've seen recently, with Matthew Perry, but I think it's also irresponsible from a spiritual perspective, to go into these states and not have anyone guide you. And if
Yeah.
someone does have a bad experience or a difficult experience, like there's no one there to reframe that, to help people, especially people with significant mental health issues. So to me, it's just like we already have enough agents out there to knock us out. We could take benzodiazepines, which are overused, and we have opiates, and we have marijuana or other drugs, that we can use to escape, if used in excess. So I just don't want to see ketamine used as that. I don't think that's the purpose of ketamine.
And not only the purpose of ketamine, but I've always been confused that the set and the setting that you have described and cultivated, it's in someone's home, they're on their couch, they're alone, and the idea of the safety that you are striving to provide, the relational quality of the way that I'm hearing you with your staff and with your clients, with yourself, your family. So it feels like it's at odds with what you're saying is a psychedelic experience, or not a psychedelic experience, but one of isolation.
Yeah, I think that's the problem. So people wake up and they're alone. People have a lot of, and that's one of the triggers for many people, feeling like you get this high and then you just drop out of it, and then you're sitting in your room by yourself alone, like, and then you just need more and more, and then it just encourages people to use more and more of this. And I think it's dangerous. Here what we do, everybody who comes through our center has to go through a medical and psychiatric screening evaluation with me, or we have nurse practitioners, and it's about an hour long intake. We go into the details of their history and make sure it's a proper option, a good option, and a safe option for them. A lot of these at home thing they do, I think, about a 15 minute, some type of just a very cursory exam that's done online, and they're never seen by a provider again. So when they come in here, they have nursing assessment. They check their vitals and blood pressure. An IV is placed. We have MAs, nurses, and we have integration coaches who work with them before and after. They have the medical staff, myself, an MD, who's really there to make sure that they're in a safe environment. They feel safe, and when you feel safe and you're contained, you're much more likely to have a good response. You're more likely to expose and reveal what you need to has to be revealed in during these type of treatments. So
Yeah, I guess we were just focusing on at-home ketamine therapy and some of the cons, the discontents of that model. I think the people that I have spoken to most trying to do some Jewish integration work, specifically with ketamine, has not been at home, but in particular ketamine clinics where they're strapped to an exam table. There's nothing on the wall. There's not even any music at all.
I know.
But given a shot or an IV, and then are checked in on maybe in 45 minutes to an hour.
Yeah. Yeah. I mean, I couldn't imagine doing that, having done it myself. I think a lot of these clinics, I bet you if you ask the doctors, have never put themselves through a ketamine infusion. I know that for a fact, many of them haven't. I think it's important because, and after I did mine and I know the depth of it, and it was one of the most significant experiences I've ever had, including, ayahuasca and mushrooms and San Pedro and everything else I've done. It was by far the deepest experience I've ever had. And I had a lot of reverence and a lot of respect for this medicine. So when I'm in there, when I'm giving it, I give it with a lot of care and a lot of reverence and humility, because it humbled me. When I did my last one at the end, I remember saying, God, I know not, like, this is what I was really left with. Like, God, I know nothing. I know nothing. I know, like, I surrendered to just knowing nothing. And it was so powerful and it was beautiful. And it's like one of the, it's one of my mantras before I walk into a room. I try and say, God, I know nothing. I know nothing. I know nothing. Let me just be a channel, and it's to go in there with that humility that this helps you get to. Was very powerful, and that's why I thought it was very important that I do that. So to be, put onto a stretcher in a room and put through one of these experiences, you can do it. Maybe it'll help some people. It's possible, but it's just going to be very different. And I don't think it's the way to do. It's not psychedelic medicine, and a lot of people see this as just another chemical, agent to a drug that's just going to cure people's depression. But I don't see depression or anxiety as a disease that needs to be cured. That's another controversial. That could be a whole other podcast.
That's
Not
true.
to say that it's not real. I'm just saying I don't think it's a genetic. And they've actually, they've done, the National Institute of Mental Health has spent billions of dollars trying to try to find a gene for mood disorders, trying to find some type of chemical or a biomarker for mood disorders, and they found nothing. There's books about this. And so I think I see, depression or our emotions in general are just like sort of messengers of letting us know that there's some type of psycho-spiritual misalignment in our life. And they're just there, like if pain, God forbid someone breaks a leg, is the pain a disease? No, the pain's a messenger letting you know there's a bone out of alignment. I could load people up with pain medications and morphine, and they can walk on the broken leg, but they're not going to go. Eventually, you're going to need more and more of the morphine, and you're going to have to take care of it at some point. Or we can put on a cast, let the bone heal, and eventually that becomes the pain is no longer necessary. The same thing with mood disorders. I think a lot of it is just entrenched, and we don't listen to ourselves. We don't listen to the messages. It will get entrenched and become more of a disorder. So
What's the line? I'm gonna butcher every aspect of the next string of words. I think it might. Is it from Krishnamurti? The idea that what you're describing is a reasonable response to an unreasonable situation, or something like that. I have to go
yeah.
back. But of course, people are suffering from uh, these kinds of maladies given the state of the world that we live in. And it's not, the hope would not be to suppress that. There is nothing to heal because it's not them that needs to heal, but the conditions outside of them, which are in need of healing themselves.
Right. Or our relation to them too, and how we see them.
Yeah.
We look at them as opportunities, not react to them in a negative way, but find more love through them. And then we connect as agents of love. And if enough people think that way, that's how we'll get rid of all the wars and all so we can only do what we can do.
Right.
But at least if we can change people's perspective and what's in front of them and make them a little less reactive, a little bit more thoughtful in how they see, their family and see the people that trigger them, I think that will bring, most likely to bring peace and to themselves and and the people around them. So, yeah.
Well, you mentioned a couple minutes ago about Matthew Perry, just in
Hmm.
passing. So, as of December 21st, 2023, I believe it was about a week ago,
Hmm.
that the actor Matthew Perry from Friends, among other things, who famously, very publicly, has struggled with addiction and abuse of various substances. The media report is that he drowned in his hot tub because of a ketamine overdose. Um, and so I think that there has been, after that, some question, concern, a lot of activity online and social media about yay or nay ketamine, including, I think I saw something from Nushama specifically about this, and from you specifically. So, how does a ketamine clinic with a deep belief in using this medicine in a good way, the way that you have described, to this situation, which is very public, and now is there, the substance itself is drawing more criticism than before?
Right. First of all, it shouldn't be given at home to someone who has an addiction, well-known history of addiction. He was on buprenorphine for opiate abuse. He had benzodiazepines in his system, lorazepam and smaller doses of clonazepam. So he's on two different benzodiazepines, which are also suppressive.
Mhm.
And together with the buprenorphine and the ketamine, not a good mix. If he was observed, if he was there with someone, he would have never died. He didn't die of ketamine poisoning or overdose. He died from drowning under the influence. And you shouldn't be doing any type of agent. I don't care if it's alcohol, ketamine, benzodiazepines in a hot tub by yourself. Period. So I think it's I don't think I think there's many things that went wrong here, but he did not die of ketamine overdose. I mean, you have to die of a ketamine overdose. I mean, you have to take enormous amounts, even higher. They said it was anesthetic doses. Even the doses he had in his system wouldn't directly kill him. It would not suppress his respiratory rate. It would not decrease his cardiac output or his gag reflex. He didn't die of that. He was in a very deep state, probably due to the mixing of the drugs, and he fell asleep or he passed out in a hot tub, which is understandable. The same way Whitney Houston died in a hot tub
Mhm.
from, I think, Ben's. I don't know what she was taking, but it's unfortunate and it's very sad. And how he got this ketamine at home, I have no idea. But no one should have prescribed him home ketamine, knowing his addiction history. So
Well,
I think this would never have happened, obviously, in a medical setting. So.
well, connecting it to his own history of addiction, can you talk about or share your perspective with regards to ketamine, which is often characterized as being different from classic psychedelics, mushroom or cacti or ayahuasca, as actually being addictive? That one can get addicted to ketamine, and that sets it apart. And in some ways, in a negative way, we saw in California when the bill was going through the state legislature, and ketamine was one of the substances that was slated to be decriminalized, that ketamine was actually removed because of, or at least they say, ketamine was removed for that reason. So, as a ketamine clinician, can you speak to that? And what should people really know?
Yeah, I agree with I don't think it should be decriminalized or allowed to without a prescription. I think it in low doses, like I said, ketamine. the effects of ketamine are very dependent on the dose, the route of administration, and yeah, and how long you it's infused through. So in lower doses, it can have a euphoric, a sort of uh, a non-psychedelic euphoric effect, and it can be addictive, and it's been shown to be addictive, and it shouldn't be used. That's the dangers of all these home ketamine centers. People can just take a little bit of a little spritz here and there every time they're feeling stressed out, and you get high, and you start seeing people using it all the time, and that's dangerous. It has many dangers. Regular use of ketamine on a daily basis can affect the bladder. It can affect a lot of things. People adapt to it. There's dangers, and it should not be used on a daily basis. So I don't think it should be sort of quote unquote not decriminalized, but it shouldn't be used without a prescription for sure. And I don't even think it should be used at home, on a regular without proper integration and care. And maybe in a therapist's office or observed, and when the dose is properly given, yes, but not just to hand people a month's supply of ketamine to use as they so fit. So yeah, I don't. I do think that we have to be careful with this substance, as any substance that's mind altering, and it should be used with reverence and with respect, and like any of them. But yeah, so hope that answers your question.
Absolutely. We're getting to the end of our time together, and I was wondering, as a lover of Jewish mystical wisdom and the Kabbalistic and Hasidic tradition, is there a particular teaching that is on your heart, mind, spirit, from any particular book or a thinker, a writer that is influencing or guiding your work at the present moment?
I mean, I love, I always listen to this. I love Rav Nachman's, work, of course. One sentence that really stuck out to me, one sort of bit of spiritual wisdom that I repeat to many of my members here and myself often is this idea of like mati velo mati. I
Mm.
love that. Is to go for something, to desire something, to want something, to want to receive something, but also at the same time to let go of it, and to be in this non-dualistic state with our desires, and to always, so like to say, okay, I want that beautiful house, but you know what, if it doesn't get, things don't work out, God doesn't, it's not for me, that there's something better for me. Might be something, maybe even a smaller house, but maybe I'll be happy in that small house. There's a path for me that God wish, and to be more open to and free to have. So it doesn't mean we don't have desire. And this is the beauty of Judaism and Kabbalah, is to acknowledge those two parts to us, and to live in harmony and balance with those two parts. But to always, and I found that very helpful in my life. So I have desires and I want, but at the same time as I wanting them, I let go of them. Doesn't mean, but I'm still going for them, but I'm letting go of them. And I found when I started really trying to live through that, it changed my life. It's a beautiful way to live. So that's something that really stuck out for me out of all the years of my and love and all these other things, of course. But that's a very practical tool. Yeah. Oh,
Well, inspired by that Aramaic phrase that you shared, mati velo mati, touching and not touching. We've touched on so many important topics, and lo mati, there's so much more to discover and discuss. So we'll leave it here today. Dr. Stephen Radowitz, thank you for being with us.
thank you, Rabbi Zac. Thank you very much for having me. I appreciate it.